Okay, good morning everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. I've done a lot of work through the years on neuropathy, and now I'm doing a new neuropathy series trying to bring you the most up-to-date information, letting you know what changed, what hasn't changed. If you're just now viewing some of these videos, give me your feedback, like, subscribe, share, all those things that we're supposed to say. But today's video, we're talking about peripheral neuropathy as it relates to alcoholism. I've already talked about peripheral neuropathy in general, did a big discussion mainly on diabetes, how diabetes is half of the representation or accounts for half of the peripheral neuropathy cases. And about half of people with diabetes will develop peripheral neuropathy. We don't like to accept this statement, that neuropathy half the time is diabetes and half the time we don't know the cause. We really want to always strive to find the underlying cause, and that's been substantiated in the literature. Dr. Dick, D-Y-C-K, out of the Mayo Clinic in Rochester, one of the world's foremost researchers on peripheral neuropathy, said that even in the tough cases, you should be able to find a cause upwards of 76% of the time. So if you've been told you have neuropathy and we don't know the cause, keep digging, and hopefully these videos will be of help, and let us know if you have any questions. So relative to today's topic with peripheral neuropathy, vitamin deficiencies, is it a thiamine deficiency or is it alcoholism creating a toxicity effect? That's what I'm going to go through, and it's a little bit of both, and hopefully I can give you some of the defining features of each one. So maybe you will be able to identify if you do overconsume, overimbibe in alcohol, you'll be able to tell, is it because of a thiamine deficiency or because of an alcohol toxicity. So this is a review article, Journal of Neurology 2019. And I really like this article, and I'm presenting it because basically they did a literature PubMed search, and they looked at 87 articles on this topic. So they basically ran through the government databases and said, okay, we're going to look at every article that has somewhat examined alcoholism as it relates to peripheral neuropathy. They then weaned down the articles, and they basically included some articles and excluded a lot of articles. And they found that upwards of 46.3% of alcoholics are going to develop peripheral neuropathy at some point. So that's a pretty significant statistic. So around half of people who suffer with alcoholism, chronically abusing alcohol, are going to develop peripheral neuropathy. So taking a step back, the effects of alcohol on the nervous system have long been acknowledged. I think the first description was in the 1700s by a clinician. And since that time, it has been well documented that alcoholism affects the cerebellum. The cerebellum is your balance center. It sits at the base of the brain, down here. And the anterior lobe of the cerebellum, deep in there on the anterior side, is primarily affected when individuals overconsume alcohol. And the anterior lobe preferentially encodes information for the legs. So the anterior lobe doesn't as much involve the arms, it involves the legs. And so this is possibly part of the reason why alcoholics, even when they're not drinking, tend to walk as though they're drunk, because their brain cannot coordinate their legs as well as it should, so to speak. And then the research started coming out showing that alcoholics can have a thiamine deficiency. What is thiamine? Thiamine is vitamin B1, and vitamin B1 is very important for nerve function. It seems that some alcoholics, when they're drinking in excess, they're not well nourished, and so they're primarily relying on the alcohol for their source of calories, and in doing so, their B vitamin levels can become depleted, not only because they're not consuming them, but also the alcohol can affect absorption of other B vitamins and vitamin B1, and so it's thought that that's what really causes the B1 deficiency, which then causes the anterior lobe syndrome of the cerebellum, as well as a thiamine deficient peripheral neuropathy. Now, several years ago, researchers started coming out saying, well, I'm working with an alcoholic peripheral neuropathy patient, but they're not thiamine deficient. They actually eat a pretty good diet, they just overconsume. So it was then that researchers tried to start like teasing out, is it thiamine deficiency or is it actually because of an alcoholic toxicity or an alcohol toxicity to the nerve tissue itself? So in this review article, they go into that at length, and they basically found that yes, there is an alcohol toxicity component to the peripheral neuropathy seen in some alcoholics, but there's a kind of a way to differentiate it. In essence, if you're a well-nourished alcoholic, meaning you eat well, but you're drinking way too much, then you're going to present more with what's referred to as small fiber peripheral neuropathy symptoms and signs. Small fiber peripheral neuropathy, if this is my sciatic nerve, if I were to cut the sciatic nerve in half, you would look at the nerve under a microscope, you'd see some of the nerves are very big in diameter and some are really small in diameter. The small diameter nerves encode pain and temperature. And when they're selectively affected, then typically people present with horrible burning pain. They may have shock symptoms. You may have discoloration in the feet. So small fiber neuropathy associated with a well-nourished alcoholic does occur, and that's the typical presenting feature of alcoholic peripheral neuropathy when somebody eats well. If somebody is not eating well and they're primarily drinking their lunch, so to speak, that's where the individual typically will present with a lower body mass. They're also going to present having signs of a lot of sensory dysfunction, so they're not going to have a lot of sensation as to, like if you put a tuning fork on their toes, they won't be able to feel that as well. They also may have some weakness. They have more what's referred to as large diameter signs. So, vibration, if I put a tuning fork on your big toe, if I move your toe up or down, checking your reflexes being diminished, some signs of weakness. Those are all large diameter nerve fiber functions, and that's how that individual is going to present. So it's kind of cool because from a clinical examination standpoint, we can actually start to say, oh, well, you look like you're thiamine deficient, or oh, you look like your thiamine's probably fine, and you're just getting a toxic effect from the alcohol. Other factors to consider are that some individuals seem to process alcohol more poorly with alcohol dehydrogenase, and I think it's acetaldehyde dehydrogenase. Don't quote me on that enzyme. But there's a variation of that enzyme in some people that doesn't allow them to detox the alcohol as well, which can then lead to more toxicity to nerve tissue. Also, there seems to be a correlation between liver disease and perhaps neuropathy having an onset. Some people say that what has been seen in the literature is statistically significant. Other people say it's not. But that's also something to consider because it seems like when liver disease is more severe, people develop peripheral neuropathy more severely in the feet. And that makes sense because alcohol affects the liver clearly, and the liver by itself, liver dysfunction can cause neuropathy. So that's worth noting as well. One of the surprising things that I found in this article is that you would think, or I would think, that something like a hard alcohol, vodka, overconsumption would more commonly lead to alcoholic peripheral neuropathy, and that's actually not the case. They have found that overconsumption of wine is the most likely form of beverage that has alcohol to cause neuropathy more than the hard alcohols, more than beer. So that's also interesting and worth noting. And relative to the liver dysfunction, we also have to think that alcohol really affects the gut microbiome in a negative way. 37 trillion bacteria in the gut, and the alcoholic microbiome is one of the most severe derangements of the microbiome that we know about. It's very similar to what's seen in psoriasis. So, if you know someone with alcoholic peripheral neuropathy, or if you think that you have alcoholic peripheral neuropathy, one of the best things you can do is be honest with your doctor about how much you're drinking. So often in my experience, and it's all throughout the neurology textbooks, that if a doctor suspects an alcoholic peripheral neuropathy, they start inquiring, how much are you drinking, how often are you drinking, and in my experience, lots of times people are not completely forthcoming about that. So the more you can be honest, just shoot straight with your doctor saying, hey, if you are over drinking, let them know what type of alcohol you're drinking, and that way they can come up with a strategy to help you, because there are blood tests to further differentiate between thiamine deficiency and alcohol toxicity beyond what I was just talking about. You can run a thiamine vitamin B1 serum blood test. The erythrocyte transketolase blood test is also viewed as the gold standard, but in my experience, it's hard to find a lab that does that. But just know, I always like to talk about labs because many times patients are told, there's nothing that can be done for you and you just need to live with it. I'd like to talk about these labs so you can talk to your doctor about them. So the erythrocyte transketolase is one of the labs that's commonly used. And if your doctor is suspecting that you have a thiamine deficiency, they may do a nerve conduction velocity and EMG test, which is where they stick needles into your arm and see how the muscles are firing, because when muscles don't get the right nerve supply, then they start to fire weirdly. And the nerve conduction velocity measures how fast the nerves are transmitting information. So that's all part of the workup to differentiate an alcoholic versus an alcoholic peripheral neuropathy patient, whether it's thiamine deficiency versus alcohol toxicity. So I hope this is helpful. Probably the next broadcast will be on B6 deficiencies and B6 toxicities. I'm really trying to hit the majority of the neuropathy cases. And keep in mind, alcoholic peripheral neuropathy by some accounts is around 10% of that entire neuropathy pie. So 50% is diabetes. About a third of the other part of the pie is prediabetes. A third is gluten sensitivities. 4 to 9% are B12 deficiencies. Around 10% are alcoholic peripheral neuropathy cases. So alcoholic peripheral neuropathy is common. Again, half of alcoholics will develop peripheral neuropathy. So food for thought. Let me know what you think about it. Send me a comment, like, subscribe, share, like I said before, and we'll be back soon with another broadcast. Okay. Thank you, everyone. Have a good day.